Hello everyone and welcome back to the Mad Max channel. Today we are reviewing primary hypertension, also known as essential hypertension. This one is the most common topic on the NCLEX and one of the most common conditions you will see in real life. Let's break it down simply. Let's start with diagnostic criteria. Blood pressure has two numbers: systolic, pressure when the heart contracts, and diastolic, pressure when the heart relaxes. Normal is below 130/80. Stage 1 hypertension is between 130 and 139 systolic or 80 and 89 diastolic. Stage 2 systolic is 40 or higher and diastolic 90 or higher. You can think of your arteries like a pipes and your heart as a pump. If the pump pushes too hard or pipes become narrow, pressure increases. Alright, let's talk about symptoms. Most people with high blood pressure feel no symptoms at all. That is why it is called silent killer. But a sudden severe headache can be a red flag for a hypertensive crisis. In that case, the blood pressure is dangerously high and need emergency care. The next is risk factors. Here are the main causes and the contributors: obesity, genetics, chronic stress, lack of physical activity, diabetes or high cholesterol, diet high in sodium and low potassium. Imagine your blood vessel like elastic tube. If they lose flexibility from poor diet or stress, your heart must pump harder. That's how hypertension starts. Now, treatment overview. Treatment usually involves lifestyle changes and medications. Let's go through the key drug classes tested on NCLEX. It may seem as a pharmacology lesson, but it is what it is. First, alpha-1 blockers: prazosin, doxorubicin, terazosin, tamsulosin. They relax blood vessels, lowering blood pressure. Most common side effects: dizziness and orthostatic hypotension. Patients should rise slowly from sitting or lying down. Also used for benign prostatic hyperplasia to help with urination. From this list, tamsulosin most common for BPH. We keep going. Number 2 is alpha-2 agonist. Most common clonidine, methyldopa, guanfacine. These act on the brain to decrease sympathetic tone. They cause vasodilation and sedation. Very important notes: never stop clonidine suddenly, it can cause rebound hypertension. Number 3 is beta blockers or LOL drugs like atenolol, metoprolol, propranolol, I think is most common, and so on. These drugs slow down the heart and reduce its workload. Side effects of beta blockers include bradycardia, bronchospasm in asthma or COPD, and masking of hypoglycemia in diabetics. You can think of beta blockers as a brake pedal for your heart. Number 4 is direct vasodilators: nitroglycerin, hydralazine, nitroprusside, minoxidil. They directly relax smooth muscle in blood vessels. Common side effects: headache, hypotension, reflex tachycardia. Nitroprusside is used in hypertensive emergency, but monitor for cyanide toxicity during long infusions. Hydralazine can cause an SLE-like syndrome. Next is number 5 is ACE inhibitors: captopril, enalapril, lisinopril. They block the conversion of angiotensin 1 to angiotensin 2, leading to vasodilation. Common side effects: dry cough, hyperkalemia, and angioedema. Next one is number 6, angiotensin 2 receptor blockers. Most common example, losartan, valsartan. They have same side effects but no cough, but still need monitor for high potassium. On the test you may have questions like, the patient have dry cough and use ACE inhibitors. What do you recommend? The right answer is ask healthcare provider to change prescription for ARBs. Next medication is number 7, calcium channel blockers. There is two group of medication. First one, dihydropyridines like amlodipine, neferipine, mainly affect vessels. And the second group's non-dihydropyridines like verapamil, diltiazem, affect both heart and vessels. Most common side effects: edema, constipation, bradycardia, reflux. Think about calcium like a trigger for contraction. The drug blocks the trigger. Number 8. Diuretics. Water pill that reduce blood volume. There is three groups of diuretics. Loop diuretics like furosemide, strong, fast-acting, but watch for low potassium. Thiazides like hydrochlorothiazide and chlorthalidone. These diuretics has mild effect, can cause increased blood sugar, lipids and uric acid. And potassium-sparing diuretics like spironolactone. These drugs help retain potassium, but watch for hyperkalemia. Think of diuretics as opening a small valve in your system to release pressure. We also need to know combination diuretics like aldactazine, which means spironolactone plus thiazide. Use it to balance potassium while controlling blood pressure. And we also need to know osmotic diuretics like mannitol. These drugs pull water into the bloodstream and use it for intracranial pressure, not hypertension. And finally, carbonic anhydrase inhibitors like acetazolamide. Mild diuretics used in glaucoma or metabolic alkalosis. And that's all medications which can manage arrhythmia. Actually, last two, osmotic and carbonic anhydrase inhibitors, is not for arrhythmia management. I just included as a group of diuretics. So let's do some recap. Primary hypertension develops slowly, often without symptoms. Controlling it early prevents damage to the brain, heart and kidneys. For the exam, remember the key side effects and contraindication for each medication group. If you found this video helpful, please give it a like, of course subscribe. And as soon as we get 10 likes, I put the link in the descriptions with a free PDF study guide. I organize everything from this lesson for easy review. And if this helps you learn like it helps me, that is my goal.